I'd just like to add that thank you for that introduction, Dr. Williams. I'd like to just add that I received funding from the USONA Institute as well as PsyDao, and that I work on the MAPS Expanded Access program, and that lastly, you'll see some very interesting images throughout my presentation, and they were made with artificial intelligence. I see there is a possibility where we in the field of psychedelics can integrate AI into our research and practice. I'm not really sure exactly how yet, but it is an interest of mine, but we'll save that for another day, I guess. So it's a widespread assumption that people with a personal or familial history of psychotic symptoms or disorders cannot safely use psychedelics. It's generally believed that this population can't use psychedelics because it can trigger a psychotic episode, can exacerbate symptoms, and can even accelerate the development of psychosis in someone who is predisposed to developing such a condition. As a result, people with psychotic disorders and symptoms are usually excluded from psychedelic treatment and research altogether. There are these exclusion criteria, of course. However, this is despite there being no modern day research conducted on this topic. Currently, psychedelic-assisted psychotherapy, or PAP, is indicated only for certain conditions, namely anxiety, depression, and PTSD. However, as psychedelic therapy goes mainstream, we need to ask ourselves some very important questions, including whether our medical recommendations are based on empirical data or whether there might be other factors influencing our beliefs and practices like stigma, fear, and misconceptions. Mental health is extremely focused on diagnosis. However, it seems that I would put forth that in the case of psychedelic therapy, diagnosis is not a perfectly reliable indicator of treatment outcomes. And what I mean by that is, for example, in these clinical trials where there are people with end-of-life anxiety, not everyone with end-of-life anxiety is responding well to these treatments. And at the same time, there are anecdotal reports of people with bipolar and various psychotic spectrum disorders reporting personal growth and symptomatic relief from psychedelic use, which I'll explain in my later slides. And just at the same time, we need to also consider how our practices affect members of marginalized groups, given that certain groups, particularly Black Americans, are overdiagnosed with psychotic disorders, excluding people with psychosis from clinical trials, and research has direct consequences for this group, and we need to keep that in mind. So to kind of understand this whole issue, we need to go back to what is called the first wave of psychedelic research, which occurred approximately in the 1950s to the mid-1960s. During this period, over thousands of psychedelic studies were conducted, and at the same time, thousands of people were subjected to extremely inhumane experimentation, which I don't have time to go into all of that, but a lot of the people that were used for this research were people of color, as well as institutionalized people with severe mental illness. I'll also mention that while there was a lot of research conducted during this period, the research lacked methodological rigor. There wasn't a lot of double-blind studies conducted. They were not really so thorough in their reporting afterwards. I'll also mention that it's really important to understand that during this early period, researchers adopted something that they called the psychotomimetic model, which was mentioned yesterday briefly, which was this model that saw psychedelic and psychotic states of consciousness as one and the same, which they're not, but there are some superficial similarities, you might say there. This model gained traction quickly, and soon people came to believe that people who are already in a psychotic state or on the border of being in one should not take psychedelics. And so that has kind of set the scene. And I believe that has had a ripple effect even to the present. And when exploring this topic and any topic within psychedelic medicine, it's crucial to seek out indigenous perspectives. Psychedelics are, of course, this has been a theme of the conference. Psychedelics are not novel Western psychiatric interventions. They have been indigenous modalities of healing long before. And we need to recognize also that psychosis itself is a Western construct, and that in some societies, individuals with abilities to, such as hearing voices of their ancestors, these individuals in some societies are not pathologized or institutionalized, believe it or not. Instead, they are seen as spiritually adept and having different abilities. And in some cases, they may even be active participants in psychedelic plant medicine ceremonies, and might even be leaders like shamans in some contexts. And I'll direct you to that article that's on the slide if you'd like to know more about that. So this is the first study that I'll present to you, which was a qualitative study. For this study, we interviewed 12 experts in psychiatry, psychedelic medicine, and religion, and we asked them kind of these overarching questions about whether PAP could be safe for people with psychotic symptoms, whether PAP could treat psychosis directly, or whether we could use psychedelic therapy to treat, say, anxiety or depression in someone who also happens to have psychosis. So those are two slightly different questions, but I think the difference there is important. We also asked them about the exclusion criteria, whether it's justified, and if psychedelic use is contraindicated for this group. So this just kind of goes over what I just said. We used a semi-structured interview style and discussed their direct experiences with psychedelics and psychosis. And this is the participant data. So one of the most common themes that came up over and over was that that psychosis as a category, psychosis as an experience, is incredibly diverse. It's heterogeneous in three aspects, it seems: symptom presentation, severity, and pathogenesis or etiology. So in terms of symptoms, there are these four dimensions, symptomatic dimensions of psychosis: hallucinations, delusions, disorganized thought or speech, and negative symptoms. And someone could have endorse one of these domains, or could have all four. There are, of course, these different disorders throughout the DSM, personality type disorders, mood disorders, or psychotic spectrum disorders. Then in terms of severity, someone's psychosis could be totally impairing, while others might still be able to carry out their day-to-day lives. And then lastly, in terms of origins, there's also a spectrum here where someone could have in part biogenetic origin to their psychosis, and the literature's showing more and more that there is a very strong correlation between trauma and psychosis symptom severity. So in regards to the exclusion criteria, the experts did say that they think that the exclusion criteria could be justified in scenarios where there's not a lot of support offered, mainly talking about these protocols where someone takes a dose, comes in, takes a dose, and they get sent home the next day or something like this, but that that doesn't mean that psychedelic therapy is contraindicated for this group, just that a more supportive context would be needed. And of course that they said an individual case-by-case assessment makes more sense than just excluding people across the board for having a diagnosis. We talked about what an initial pilot study might look like for this group, and they mentioned, that someone should be above 30, have a history of perhaps just mild symptoms at first, and have a very strong therapeutic alliance with their sitter, as well as a strong support network outside of therapy. They also mentioned that it would be worthwhile to maybe even do this on an inpatient basis at first, again, just making sure that there's enough support in place. We then talked about the different compounds that could be used. Throughout this conference, a lot of different medicines were mentioned, and in this context, MDMA came up several times for its ability to open people up in a kind of a soft and gentle way and help to kind of process trauma. Some said psilocybin could reactivate traumatic memories. Ayahuasca could be problematic. Again, ketamine and MDMA could be safe, but they both have the potential to be abused, so keeping that in mind. And lastly, one participant even mentioned combining MDMA and psilocybin to kind of reset the default mode network. That was his thinking, at least. And so overall, these opinions departed from these beliefs that people with psychotic symptoms should not use psychedelics. I should mention that I asked experts who had years of training with psychedelics. They weren't drug naive experts, so perhaps that's something worth mentioning. But overall, the experts believe that highly supportive psychedelic therapy that is also tailored could be useful to some people with psychotic symptoms and disorders, and that overall the exclusion criteria for less supportive studies may be justifiable, but that psychosis is largely a heterogeneous experience, and that people should not be reduced to a diagnosis, but rather candidacy should be considered holistically. And so from there, we thought that the next step would be to do a survey and gather another form of expert opinion, which is the experts, those who are having psychotic experiences themselves. And so we asked, well, this survey asked people who have had a history of a psychotic experience and have tried a psychedelic at least once in their life to answer these questions. But our research questions are whether, well, how, first of all, how do people with psychosis report psychedelic use? It's kind of has a phenomenological approach here. How are there any relationships between variables, set and setting, the drug, the dose, the specific diagnosis? What proportion of the sample had challenging experiences? And do people with psychosis report a change in with their symptoms after using psychedelics? And so we posted the survey on various social media platforms. Again, that someone has to have had a psychedelic experience as well as have been diagnosed with a psychotic disorder, have symptoms. The survey includes a range of different items. We gathered a lot of data regarding their psychedelic use, the set and setting, their mood, were they on medications at the time? We also included the MEQ, parts of the MEQ. And so what I'm going to present to you now is an initial analysis of 16 respondents' answers. So it's just keep that in mind. It is a small sample and we're still collecting the data, but hopefully you will see that there is a trend that emerged. So for one of the items, it asked people if their psychedelic experience resulted in personal growth, and they could say yes, no, somewhat, or not answer. And so in that top table, you see experiences that resulted in some degree of personal growth. And in that bottom table, you see experiences that did not result in any growth. So that column to the right indicating that. And blue would be participant. I should also mention that for this, we said, keep in mind one psychedelic experience that is memorable to you and answer the survey just thinking about that experience. So we had some people, who chose psilocybin to report on, LSD, etc. And so blue is psilocybin, purple is ketamine, and yellow is LSD. And I think it's an interesting, at least initial finding here is just that almost everyone who used psilocybin said their experience resulted in some degree of personal growth, except for the person that mixed their psilocybin with cannabis and amphetamines. Almost everyone who had tried LSD reported that their experience did not result in any growth. And the one person who did say it resulted in some degree of growth was fully comfortable in their setting, right? So you see that the other column there. And then ketamine, that's such a small sample. I don't even think we can draw anything from that, but just a overview there. And now I'll go into some more qualitative findings. We asked people to describe their psychedelic experience overall, and there were kind of these two main parts. People who reported improvements in symptoms and people who reported worsening. You can read these for yourself. I won't read all of them, but reduced paranoia. One person said that they had a surprising recovery on ketamine. They got out of their ketamine journey and said their psychosis was gone. Psychedelics opened my heart, reduced fear. I feel like psychedelics open my heart and make me feel less alone. I'm not certain if it lessens my hallucinations, but it definitely makes them more bearable because it removes the fear and makes me feel more connected. Ketamine, diagnosis of schizophrenia, and they were comfortable in their setting. So this is reporting of worsening symptoms, and these aren't perfectly binary categories. This participant 3 said that it made their symptoms worse, but at the same time, it showed them that they had a gift of higher perception, that's what their psychosis was, they realized. Made their psychosis worse, worst mistake of my life, giant 15-hour bad trip. Awful, made the psychosis much, much worse. And that's combining LSD, alcohol, nicotine, and cannabis. in an uncomfortable setting. So taking the context into consideration a little bit, you know? And then just some quantitative data here. 62% of all the participants experienced some degree of personal growth from their psychedelic use. 87% of those who took psilocybin in a comfortable or somewhat comfortable setting experienced personal growth. 100% of those who took LSD in a somewhat or totally uncomfortable setting did not experience personal growth. 67% of participants who had challenging experiences also consumed other substances. 100% of participants who took psilocybin reported it helps them process trauma. So just one of the questions was, did your experience help you process traumatic memories? Yes, no, somewhat. 33% of those who took LSD said it helped them process trauma. 75% of participants reported experiencing self-love after their experience. 69% of participants reported realizing their thoughts were probably untrue after their experience. And 86% of participants rated at least one item on the MEQ a 10 out of 10. And so in summary, psychedelic use in people with, among people with psychosis can result in personal growth and symptomatic relief. Set and setting, as well as the specific compound used, may affect the overall experience. Psilocybin may assist in processing trauma for people with psychotic disorders, particularly when the setting is comfortable. Psychedelics can reduce paranoia, delusional thinking, and increase self-love in people with psychotic disorders. Mystical experiences are possible in this population. LSD can lead to challenging experiences for this group. And further research is needed, but I think the data speak for itself. Safe use of psychedelics in people with psychosis is possible. Thank you.
We have time for a question or two before we move into our next segment. One of the questions that came up is, do you think that this group is at risk for having more challenging experiences than other groups?
Yeah, I think that is certainly a possibility, and I want to do a study like that at some point where we're comparing what proportion of this group has challenging experiences as compared to, say, people with anxiety and so on. It's a perfectly valid question.
And do you think there's a risk of psychedelic research, rolling back, being banned again, if people like those with psychosis end up having bad results in treatment?
Yeah, thank you for that question. I would like to point out that there's a risk in everything. I mean, there's the risk that this gets rolled back. There's also the risk that people don't get the treatment that they need. So we, as people moving this forward, need to weigh those risks.
Right, and last question is, how can we advocate for the inclusion of different stigmatized groups, such as those with psychosis, in the psychedelic space, or should we?
Yeah, I would ask that if you have a stigmatized condition and feel comfortable and want to come out and speak openly about your use of psychedelic medicine and how it's helped you or how it hasn't, I would see that as really having the potential to make a big change. Thank you.
Thank you so much.